All right, Brett, thank you. All right, well, afternoon, guys, and thanks for taking time to hop on our weekly update call. We'll go ahead and just like normal, start with a review of the data. So I'll turn it over to Jordan, our epidemiologist, and let her kind of share that information with you.
Hi, everyone. So you should be seeing the My Safe Start Excel sheet. A few of our counties are looking a little bit better than last week, with Manistee County in the B risk level, Mason is in C, Kalkaska, Mecosta, and Oceana are in D, and Crawford, Lake, Missaukee, Newaygo, and Wexford are in E. Our cases per million and percent positivity do continue to increase, with our percent positivity approaching 10% for the jurisdiction overall. And we do have a couple of counties, particularly Missaukee and Wexford, that are really driving up that cases per million average. And Crawford, Missaukee, and Wexford are kind of driving up the percent positivity average. So outbreaks are continuing to emerge and be resolved. So hopefully we'll see a decline once those start to really resolve themselves. There were 503 new cases over the past week, and the week before that there were 375 cases. So we have seen a 34% increase in cases when comparing last week to this week. The cases that we saw in the past week were identified as household and community contact, school, jail, recent travel, religious services, social gatherings, pre-procedure testing, sports team exposures, and worksite exposures. Our total number of jurisdiction-wide cases as of yesterday at 3 o'clock was 12,924. And the cases by county as of yesterday are Crawford with 619, Kalkaska 652, Lake 376, Manistee 780, Mason 1,203, Mecosta 2,008, with Ferris State reporting 630 cases, Missaukee 822, Newaygo 2,932, Oceana 1,848, and Wexford 1,684. In the past week, we had 4 deaths reported and 151 people who recovered. Yesterday, there were 16 positive inpatient cases at Munson Healthcare Cadillac, 7 at Munson Grayling, 0 at Munson Manistee, 3 at Spectrum Health Big Rapids, 1 at Spectrum Health Gerber Memorial, and 2 at Spectrum Health Ludington. And now I will share the vaccine table with you. Okay, so you should be seeing the vaccine data now. I did add in a column of the number of J&J doses we have given. So Kevin, if you want to touch a little more on that, I think these were given to the homebound population though. That's why the numbers are low and we're not giving those to the public yet from my understanding, but I'll let you cover that piece. We have still, as District Health Department number 10, been administering approximately 56.7% of vaccines in our counties when comparing to the total number of doses that were given in our county. And 38,048 people have completed their vaccination series so far in our 10 counties. Are there any questions?
I'm trying to find my hand raiser here. A quick question for you is just wondering, back on your former chart, it looks like about 2 or 3 counties went into the E level. What is driving that most? That's causing that, Jordan?
So this the data does change on that other chart from day to day. So if you were to look tomorrow, it could be something could say something different. So the risk level is based on the daily cases per million number and the percent positivity. Usually for our counties, it goes off the daily cases per million because those are typically worse than our percent positivity in our counties. So it's just a range, and there's different categories. I think they're on the very beginning of the sheet actually. So it just sort of depends day to day what's going on, and this is calculated probably a couple days back from when I pulled it. I did pull it this morning, but I know it sometimes takes the My Safe Start website a couple days to catch up. So it could be based on things that were happening a couple of days ago.
And if I remember right from previous conversations, it's 150 is what will drop you down into the next level, right? To level D, below 150.
Yes, that's correct.
And so then I'm looking at a couple of these, they're in the 600s. And what is driving that to get to that large number?
Yes, so those are Masaki and Wexford counties. And so we know we've had some large outbreaks involving those two counties in particular. So like I said, it sometimes is based off a couple days back. So we have been seeing their numbers sort of slow down here, but if it's on a couple days back, we were still dealing with large numbers coming out of those counties regarding the outbreaks. So that's why it's so high at this time.
Okay. And how long is it before, Jordan, that this information gets to the state state chart that gets made?
The My Safe Start
Right,
site.
correct.
So this is pulled from the My Safe Start site. You can
okay.
see what days they are actually from on that site. Usually it'll say as of a certain day. I pull all this information as of the day before, but that doesn't always mean that, you know, the daily cases are usually updated and this is updated, but the weekly trend might only be updated every Wednesday, so to say. So if we're presenting on Tuesday, then that's based on last Wednesday's data. So I can include that at the top for next time of exactly what days these numbers were updated on, if that would help.
Okay. Thank you very much.
You're welcome.
Any other questions for Jordan on the data? All right, thanks, Jordan. Well, as Jordan said, we are, in some of our counties, we do have some ongoing outbreaks that we are, trying to get a handle on and get things addressed with those. A couple of those, we are working with representatives from MDHHS as well as, the entities themselves to try and provide some additional resources in there to kind of really get a better handle on what's going on in terms of some additional testing to see if we are dealing with the variants. Our best guess is we probably are because of the number of cases that we're seeing and how quickly they are exploring. Unfortunately, we may not learn as to whether or not a variant is there until a couple weeks after the fact, because it's additional testing that takes a little bit longer to find out. So we do try to to find that out as best we can. We're also working with our schools, trying to get our schools through until spring break, and then hopefully not see any spike in cases after spring break. We were fortunate after Thanksgiving and after Christmas, we really did not see a significant increase in cases amongst our schools as a result of that, of those two little breaks. So hoping that we'll see the same thing with, with spring break out there. So those are just kind of ongoing things that we're doing in addition to all of the vaccination clinics that we're operating. Guidance and eligibility for vaccination is ever changing. As of yesterday, it opened up to those 16 and older, with health conditions who are eligible for vaccine, and then by next Monday, the 5th, it's slated to open up to anyone 16 and up. And so Again, I'm not quite sure why they do that 1 week little clarification in there, but we have decided, District Health Department number 10 has made the decision. We are just going to open up at this point to 16 and up across the board and begin vaccinating. So we are putting individuals who are interested in getting vaccinated on a waiting list if they're 16 and older. Part of the reason for that is our internal policy is that anyone under 18 that wishes to get vaccinated does need to have parental permission to do that. 18 and up, you can provide that permission yourself, but 16, 17-year-olds are only able to be vaccinated with their parents' permission. We also need to assure that with that population that we have Pfizer vaccine available in that community. Pfizer is the only vaccine that is currently approved for individuals 16, 17, and up. All of the other vaccines, I believe, are 18 and up, although they are currently doing studies to determine whether or not it's safe to use in a younger population. I'm not quite sure when we're going to hear about that, but as of right now, Pfizer is the only vaccine that is approved for the 16 and 17-year-olds. And so generally, we do not use Pfizer in all 10 of our counties, but we have the ability to move that vaccine around if necessary. We are working with the state, and the state has indicated they will provide us with another ultra cold freezer storage unit that we'll place in our northern counties so that actually we'll be able to take and split our Pfizer order so that half of it can stay in our southern counties in our Big Rapids location, and then the other half can come up most likely to Manistee is where we'll store it in our northern counties. And then logistically, that'll just make it easier for us to transport and move that around. We also are beginning to utilize our Johnson & Johnson vaccine. Not sure if we're going to see any Johnson & Johnson vaccine again for next week. The state still has not heard yet if they're going to get it. I was on a call before this where basically the state has indicated that the amount of Pfizer and Moderna that we're currently getting is probably pretty much tapped out. And so, what we have gotten the past 2 weeks or so is probably what we're going to continue to see related to Pfizer and Moderna. And for us, that's for first doses with both of those combined is a little over 5,000 doses of vaccine that we're going to get. The increase that is expected would be in that Johnson & Johnson vaccine, and we're kind of waiting to see what that actual increase might be. We've initially targeted our Johnson & Johnson vaccine for the homebound population or that congregate living type residents or living conditions. So it could be homeless shelters, jails, prisons in the case of the facility we have in Baldwin. So looking to try and utilize that in those facilities, and then we'll be moving that out more into the general population and providing the Johnson & Johnson as part of our clinics, clinics specifically with Johnson & Johnson. Again, Johnson & Johnson is the one and done vaccine, just a single dose. You don't have to come back for 2 doses. Unlike the Pfizer and Moderna, which does require 2 doses. So our clinic schedules moving forward, we do continue to do our first dose clinics on Wednesdays and Fridays, and our second dose clinics are generally on Saturdays. Those are larger clinics off-site, and we are utilizing assistance from the National Guard in operating those clinics. And so we will continue to do that as long as their availability is provided to us. It provides us a little break for our staff and allows us to get some people some time off, which is really kind of getting harder to do right now because when we're not in vaccination clinic, we've been spending a lot of time with contact tracing and case investigation because of the increase in cases, positive cases that we're seeing. Hopefully we're going to see that, that kind of drop down. The increase in cases was kind of projected with the variants. You may have remembered when Dr. Morris was on this meeting, she had indicated and had shared some information that around March and April, it was projected that the variants would be kind of the predominant virus that we'd be seeing, virus strains we'd be seeing that time, and that we would expect to see an uptick in cases. And so that's kind of what we believe we're seeing. Related to the cases that we're seeing in schools, we're not generally seeing any spread or infection within the school system. Generally, that infection is coming from outside the school, from the community into the schools. So again, not necessarily seeing a lot of new positive cases, a significant number of quarantine individuals as a result of it, but not a significant number of new positive cases across our jurisdiction. So, other information to share. Again, CDC did modify guidance for residential locations, and so individuals who are fully vaccinated, in a residential setting, do not have to wear masks with other individuals or those who may not be vaccinated but are low risk for infection. So that is another benefit of being fully vaccinated. And fully vaccinated is the time frame is 2 weeks after you've received your second shot in a 2-dose series, or 2 weeks after a single dose in a single dose series. The individual is considered to be fully vaccinated. We have seen individuals who have been fully vaccinated still test positive, so there still is that the guidance to quarantine and isolate if necessary. And in addition to that, it's really just kind to address questions that are out there. When we moved to 16 and up, we did get a significant number of questions from folks as to why only we were promoting the Pfizer vaccine for them. And the simple reason was that was the only vaccine that has been approved for those 16 and up. So really no other reason at this point other than it's the only vaccine that has been approved. The call that I was on before this, when they talked a little bit about the Pfizer and Moderna, the state may be also changing how they allocate vaccine, with basically vaccine going to the local health departments, and then the local health departments will push it out to the various entities in the community or in the jurisdiction that are approved providers for that. So the state is hoping to get that set up before we expand the eligibility criteria on the 5th. So kind of waiting to see when they may pull the trigger on that one. I would expect if it's going to happen, it's going to happen pretty soon here. And other than that, I think that's pretty much the information that I have to share today, unless you guys have specific questions on anything.
Kevin, Doug Pratt.
Yep.
Crawford. I have EMS agencies contact me stating that they have employees that would be willing to take the Johnson & Johnson vaccine, but refuse to do the Pfizer or Moderna. Okay. Any chance of getting some of that Johnson & Johnson so we could use it for our EMS agencies?
Yeah, Doug, why don't you send me an email with the information, and I'll pass it on to our public health nurse up there, Jessica, and we'll see about getting her to do that. Right now, we're individually on a county by county basis kind of scheduling those clinics, because we're having to work them into our other, outside of our normal clinics. If we don't have enough people to use an entire vial of vaccine, it's difficult. So we're trying to set those up separately right now.
Okay, thank you.
Yep.
Kevin, this is Toby.
Yep.
You and I had some correspondence back and forth, and I just want to clarify that as we put together policies about suspected cases and what we do for employees, that whether we still put them, if they quarantine, depending upon where they are in the vaccination cycle, if they've been vaccinated. But even if they have been vaccinated, if that vaccination's been 3 months old, it's no longer effective, according to my interpretation of what we've talked about.
Actually, Toby, that has changed too in the course of those emails going back and forth. Okay. In reviewing in reviewing the CDC guidance and requirements, they quietly removed that 3-month time frame. So that's not on there anymore. We expected that gradually, as more people got vaccinated, and as they continued to kind of study the immunity, that 3-month would kind of get pushed out to maybe 6 months and maybe 9 months, a year, and then eventually kind of disappear. But right now it's totally disappeared. So the only limiting factor is that the individual has met that definition of fully vaccinated, which is going to be 2 weeks after their second shot in a 2-dose series, or 2 weeks after, they get a single dose in a 1-dose series. There is no end point there any longer.
Great. I was a little bit perplexed by it, but
Yep.
I know it's still evolving. So, all right, thank you.
Yep. Yeah, Daniel?
Yeah, my name is Daniel Conklin with Kalkaska Memorial Health Center. Just wanted to share with the group that we have a fully vaccinated employee who tested positive for the UK variant. We got confirmation from the state today.
Yep. Not surprising. I mean, we've known those variants have been there. Does the person reside in Kalkaska, Daniel?
They do.
Okay. Okay.
So out of curiosity, is that person sick or symptomatic or for being fully vaccinated?
Yep, has symptoms. Flagged on our screening process and became symptomatic. So we tested in-house on our Abbott ID Now, was positive, and at that point we wanted to determine does this team member, because they are fully vaccinated, do they have antibodies, or was it a variant, just for educational purposes. And so that information was coordinated with Annette and our employee health nurse, Christine Bissonette, and specimens, 2 swabs were collected, sent to the state, along with a serum to look for antibodies.
Haven't have all those results come back yet, Daniel?
We don't know about the antibodies yet.
Okay.
Just confirmation this morning that it was the UK variant.
Okay. And really the only, in terms of addressing that, really with the variants, is whereas normal the quarantine period would be 10 days, in this case we would go to 14 days is what CDC is recommending.
14 days from the positive test?
14 days. Well, unless they're symptomatic, then it would go back from the start of symptoms.
Okay.
A lot of times when we find out about these with the variants, the person is already out of quarantine or isolation. And so, there's sometimes not a lot that we could do other than to know that the variant is present in the community. And again, that's due to the time frame with the testing. Other questions? All right. Well, at the start, Brett had indicated this is kind of the last. This is the last meeting in this series. So I will, we'll put this out to the group. Do you want to? Number one, do you want to continue to do these updates? And if so, what's the frequency? Do you want to continue to do them weekly? Do you want to do them every other week? It's really the group's pleasure in terms of how you'd like to move forward with this.
I think these groups are really helpful. and I'd like to see them continued. I'd be fine with going every other week if that would make things easier, but I find the information very helpful.
Yeah, I mean, weekly or every other week really doesn't matter to us. Once they're on the calendar, we know when they're going to take place, and we can prepare for them. So it's really what you guys find beneficial.
I would like to keep it just the way you have it.
Weekly does get the information to us quicker, and the meetings tend to be shorter because there's less to provide.
Okay. Okay. Stuff coming through in the chat says weekly is preferred. So we will go ahead and, Brett, I guess let's set them up for weekly to continue, and probably why don't we set them through the end of May, and we can kind of determine if we need to keep going or not.
Sounds good.
Okay. All right. Is there anything else specifically that you would like to see addressed in these weekly updates, in addition to the data that we share and kind of an update on the vaccination part of it? Anything specific that you'd like to see added? I know we did when the variants started, we brought Dr. Morrison and asked her to kind of do a little presentation on the variants. Is that something that or something specific that you would also like to see added in here? Maybe not on a regular basis, but just a one-time.
This is Deb again. I think that on a routine basis, it'd be really nice to just highlight any new changes from the CDC. The question about when do we end the 3-month, I hadn't seen that guideline. So that was news to me, and I try to really watch and research that. So you guys catch that stuff first. If maybe just highlight anything that's new would be great.
Yeah, we can do that. And honestly, the only way we found out about that was because of Toby going back and forth on an email. Otherwise, CDC didn't. CDC made no announcement that they were removing that. They just kind of did that, and we found out about it because of that conversation. So
yeah, well, that was useful information, as well as the information on 14 days for a variant for isolation. I didn't know that either, so that's good.
Yep. Oh, I guess one other thing just to kind of share with you regarding vaccination opportunities. The pharmacies are through the pharmacy vaccination program are getting additional allocations of vaccine to them through the federal program. So Myers, Walgreens, Rite Aid pharmacies are also providing vaccination opportunities. And I believe now our FQHCs are also getting vaccine. So there are increased opportunities within our communities for individuals to get vaccinated if they wish. So just to put that out there.
Hey, Kevin, this is Sarah. I wonder just maybe share that we are working with a number of work sites in the communities, whether they're manufacturing or other work sites, to get their employees vaccinated, and also working with a number of agricultural settings, both food production and a number of farms, to get their year-round employees. And as their seasonal workers come on board, we're working with them as well. And maybe you said that before I got on, and I apologize.
Yeah, no, I did not. Nope, I had not mentioned that. So thank you.
Sarah, this is Toby. Have any governmental entities like counties done anything like that as major employers? And also, have they done anything with inmates?
We've worked with a number of the counties. Our local schedulers have reached out to let work sites, including government, know that we are open and able to schedule them. Right now, our links are live online, but we reserve a number of vaccine appointments, depending on the county. It might be 50, it might be 100 to work with specific targeted work sites. What was the second half of your question? Sorry, Toby.
And no, that's right. Anything to do with inmates in the jail.
Kevin, I'm not quite sure if nursing is doing that, or I know that in some instances you're working with the guard.
Yeah, we are actually, Toby, if the jail is interested in getting those people, that's another one of those, as I mentioned, those congregate living arrangements where we are utilizing Johnson & Johnson vaccines. So we're kind of scheduling those on a county by county basis. I know there was a letter that went to all the counties and all the health departments from the ACLU indicating that, you know, the prisoners should be afforded, inmates should be afforded vaccination, that they were currently prioritized for that. So, you know, we have been reaching out, and I know in some of our counties they've got that set up. It hasn't happened yet, but they do have dates set up. Those again are clinics. Those are smaller clinics that our staff are trying to set up in amongst our other larger clinics that we're doing.
Okay. All right. Thanks.
Any other questions you guys have? Okay, if not, that is all that I have. Brett will go ahead and kind of extend this meeting. We'll run it. We'll continue to do it weekly, same time. And then we will, although we may have to look at changing the date. We don't, unless we can come up with another date right now, only because starting the week of April 19th, we are going to be changing our first dose clinics to Tuesday and Wednesday. So I know it will make it more difficult for Brett and Jordan and even myself to be able to get on these calls because we'll be working clinics most likely. That would leave probably Mondays or Thursdays as available days to do the update call in. I would be thinking that Thursday may be a better day at 3 o'clock. Jordan, is there do you know off the top of your head, is that a bad time for you?
Let me check real fast. I think it should work if it's at 3.
Brett, what about you in terms of setting?
Yeah, I think that works.
3 looks good for me.
Anybody, I mean, if we move it to Thursday at 3 o'clock, is that fine, guys?
Works for Crawford.
Okay, we'll just plan on then when you redo this, why don't we just plan on moving it to Thursday at 3 o'clock then, and we'll just kind of start that. We'll just start with that as we pick these back up.
Sounds good.
Okay. All right, then we will plan to do this Thursday next week and go from there. Again, if you have any other questions, go ahead and email them to me. We'll try to get an answer to you. Otherwise, again, thanks for taking time to get on our weekly update call. And everybody stay safe and be healthy. Thanks, guys.
Thanks, Kevin.